Hello, my name is Dr. Patrick Dixon, and I'm a physician in my first training. But for the last few years, I've been working as an advisor to around 400 of the largest 1,000 2,000 companies in the world, helping them to understand the future. And that means the future of everything, ranging from technology to mobile payments to real estate to healthcare. And of course, with coronavirus, every one of those large corporations is working flat out to keep ahead of global change. And as an experiment, now that I'm here in my own home office, I'm giving you the opportunity. We'll be doing this regularly, but this is not the first time I've done this, to give you the opportunity to ask me questions about any aspect of the current situation, including the impact on your business, your family, wider world, but most importantly, looking beyond coronavirus to thinking how this will impact our universe in the future. And one of the questions many people are asking me is, just how bad is it going to be, and how do we know what the statistics actually are? Of course, it's very difficult to be certain in your own country. I've got a long list here of the current statistics for every country, and I can tell you that it's very difficult to get to the truth about the actual situation in any nation. But let's suppose for the beginning that we can actually be reasonably confident of picking up most of the deaths. Now, I know that that is not a full given conclusion because you can miss things. But diagnosing this from x-rays is relatively straightforward because the classical signs on the chest x-ray are relatively easy to spot if you're used to looking for it, and or if you've been picking up on the research from Italy, from China, and other nations like South Korea about what to look for. But the general statistic is this, that in an average country where the numbers of infections are increasing by around doubling it roughly every 4 to 5 days, then if you look at the number of deaths in a country and you multiply it by around 1,000, that is the kind of estimate that most governments are now using to work out how many are infected in their own nation. So let's take the UK. So in the UK, as of today, we have 71 deaths. That's recorded deaths, and of course, there may be others that we have missed. But let's take that figure of 71, which would give a round figure of around 71,000 infected today. The current government estimate is about 60,000. So it's of that order. But if you look at the actual number of infected cases in the UK, then we only land up with officially 2,600. So increasing by around 600 to 700 in the last 24 hours. So the key really is to understand the number of people who have actually died. And the next statistic that's really important from that is to try to understand what the impact is on the healthcare system for, let's say, every 100 people that have become infected. What does that actually mean? Well, for a start, that's 100 people who are actually registered as infected, because most of the people who are infected were missing. So let's do the maths. If you take, let's say, 100 people who are symptomatic enough, or for some reason or another they've been tested, perhaps because they're in hospital for another reason. Let's take 100. You take 100 of the official statistics for those infected in your own country, and I can give you statistics for every country here if you want. Out of that 100, a government at the moment would probably be expecting around 12 of those to be in hospital. And of those 12, 6 will be in an intensive care unit, and around 3 of those will be younger people, 12 to, well, more likely to be 20 years old up to 60, and around half of them will be people over the age of 60. And we know that most of the people, nearly all of the people who are actually dying, are those who have been through that intensive care experience. They've been on a ventilator, and they're in the older age group. Really, the issue is not so much age. The issue is the size of the medical record that they have before they become sick. And we know that there are 2 phases of this illness. There's the first phase, which is around a week, which then usually resolves, and then you get a second phase. And the second phase means that we're beginning to see the immune reaction. And the reaction to the virus is actually more damaging in a way than the virus itself, causing all kinds of systemic effects across the whole body with impacts on liver, kidney, um, lungs, just about every part of the body being hit eventually by sepsis in the most extreme cases. And it is sepsis which is causing often the person to die. So once you've got that in your mind, 100 cases that have been detected in a country that's testing reasonably widely, like the UK, means probably 30% pretty symptomatic. It means probably 12% who are actually in hospital, 6 in intensive care, and so on. It's that sort of figure, but I mean it varies to some degree depending on the country, their provision for intensive care, and the speed of infection. So the big issue is, at what speed is it becoming a massive problem rather than just the smaller problem? So, for instance, Mexico has apparently a tiny number of cases. That's probably an issue of detection rather than the reality. But if we think that in most countries the numbers have taken only 4 to 5 days to double, then we can begin to do the maths. And the maths is awful, which is why it is that governments are now moving so rapidly towards containment. So, I mean, I've been used to this concept of doubling time for over 30 years since I first began work as a doctor trying to prevent the spread of another mutant virus which hopped from animals into humans. And that virus was HIV. And I first became involved in the fight against that virus in 1988, which is pretty early. And if you think that only 2 years previously we thought the blood supply was safe, we thought that Africa was immune, and so on. But the doubling time was the most important thing we wanted to know with HIV. How long does it take for one person to infect 2? How long does it take for the numbers to double from 2 to 4, from 4 to 8, from 8 to 16, and so on? To have a doubling time of only 4 days, 5 days, is really very short. What it means is, if you go through just 10 doublings, you get from 1 case to 1,000. So if you take today's cases of deaths in the UK, let's say, and you multiply them up by 800 to 1,000, so you get a figure of between 60,000 and 80,000 infections. Let's suppose it's only 50,000. Well, you double it, and it gets to 100,000. That's one doubling. You get to 200,000, 400,000, 800,000. 1.6 million, and we've only gone through 1, 2, 3, 4, 5 doublings, and that's only 25 days away. So that's less than a month, and you go from today's 50,000 to 1.6 million. The trouble is what happens next in the following 4 days, 5 days. You get up from 1.6 million to 3 million. And in the following 4 to 5 days, again, if nothing changes and it continues to spread as it is, then you get up to some very large numbers very quickly. Okay, let's rewind the numbers and we say, okay, the doubling time is now 8 days, 9 days. We hope that that will be the case as a result of containment measures, as a result of ensuring that the streets, the bars, the clubs, the cinemas are deserted, ensuring that everybody just about works from home who possibly can. So we delayed the doubling time dramatically, let's say to only 10 days. Okay, so 10 days. So what happens? Well, unfortunately, you do still get there in the end. It's just that it takes longer. So 10 days for one doubling. Okay, so you double from, let's say, 50,000 to 100,000 in 10 days. In following 10 days, you go to 200,000. 10 days later to 400,000. 10 days later to 800,000. 10 days later, you get to 1.6 million. The following 10-day period, you go to 3.2 million, and the following 10-day period, you go to 6.4 million, and at which case the government says, okay, we get it. So even with massive social containment measures, you get there more or less in the end. Now, the exception to that is a country like China, which has closed the whole system down. But you can't do that forever. And what is actually meant is that China, most of the country, is just as exposed to coronavirus as the rest of the world because the population hasn't got antibodies. And in fact, that's the same for most of the Wuhan district. So what it means is that this is going to be here for a long time. And for China itself, even if China was to regularly push back and each time a city is hit like severely, it does a Wuhan type of response, it would still take a great many months for each city to go through its own mini epidemic, to be closed down and so on, before China manages to build up enough immunity across the whole country that future epidemics are not very likely. And that would mean 50, 60, 70% of China infected. Now, people often say to me, so what about, the vaccine? Vaccines are a real issue. We've been looking for a vaccine for HIV now for 30 years. And I have to say, 30 years ago, I used to say as a physician that I thought that a vaccine would take about 15 years to create for HIV, because HIV changes so incredibly fast in its outside coating, which is the bit we need to be stable, really, to target an immune response. And this is the real difficulty that we're having with vaccine technology for coronavirus. Now, it's much more stable than HIV. At least the outside surface is a target which is consistent, that you can create a therapy for. But the trouble is, you can't just roll it out. We have to be sure that the vaccine itself doesn't produce some kind of massive immune reaction of some kind. We have to be sure that the vaccine doesn't inadvertently make people sicker if they do get coronavirus by somehow stimulating a dangerous immune response. So to do that takes time. It means you have to have a number of volunteers, and then you have to be sure it works. And how do you do that? Well, ideally, what you do is you recruit. The ethics of this are questionable, but you get 1,000 volunteers from some university, none of whom are infected with coronavirus. You then give them all the vaccine, and then you deliberately expose them to this kind of virus and see what happens. Well, these things are difficult to do. They're difficult to do ethically. They carry risks, and they have to be done very carefully. And I promise you this, that even if you were to find the answer to the vaccine problem, the challenge of rolling out a vaccine to cover whatever it is, 7.5 to 7.6 billion people worldwide is absolutely huge. So that is the reason why those who are really experts in this field, people who've been involved in vaccine technology for decades, are saying, just take a deep breath here. Please don't think that the vaccine technology alone will produce the answer that you need. You have to be prepared that there is no vaccine available that will rescue us for at least 12 months. And governments must be responsible. They have to take the view that the responses to coronavirus need to take place now. We need to stagger out the pressures on the NHS or your own National Health Service. Now, people say, well, what should governments do about schools? And schools is a really big issue, because if you close down schools, unfortunately, some of the people who pick up school kids and look after them are going to be the grandparents, and it's the grandparents who are the most vulnerable. On the other hand, if you don't, if you keep people in school, then you've got a hotbed for infection. And there's another challenge too. If you send people home, it may well be that quite a lot of care workers are straight away struck off. They can't get to work. They can't do what we need them to do. So it's a real dilemma. And nevertheless, I predict that in countries like the UK, the pressure will be overwhelming from teachers. Yes, indeed, I agree with you. I predict that the schools will be closed in the UK very soon. Thank you for that, Dwayne. I think that's correct. And the reasons are severalfold. One is we have teachers already putting in themselves into self-quarantine because they think they've got kids at home who are sick. We've got the children themselves are unwell, so many are staying away. We've got parents who are withdrawing their children because they're afraid of infection. We've got a whole host of other situations. And of course, we've got the Easter holidays anyway. So I think that with the Easter break coming up, in many countries of the world, they will bring ahead the Easter break. They will let people go into the Easter holidays, and then they will have the opportunity to work out what they want to do in about 2 to 3 weeks' time, by which time I think we'll be in a very, very different situation. And my guess is that most of those schools are not going to open. So what about another question I get asked is, what about travel? Is this kind of thing that hello, Nick. Welcome to Periscope. First time I see that you've been on it. Please do pose any question that you like. What about the issues for travel, for countries who are closing borders? Is this a sensible thing to do? Well, yes and no. The trouble is that, as we've seen before, when you did the maths, even if you were to block every border, if you've got 1,000 cases inside your country, it really doesn't make too much difference, sadly, whether another 200 cases come in by plane or not. If you have 1,000 cases already, those numbers will probably be, in 4 or 5 days, 2,000 cases, and then 4,000 cases, and then 8,000 cases. But the other issue is this, that if you've got a country that's reporting 1,000 cases, the likelihood is that you've really got 10. It's just that you haven't found the other 9,000. So that means that it's even less of an impact if you decide to sort of close down all your borders. Doctor, can I ask a question about the transmission of the virus? There's so many different theories. There are indeed. Let's go with what we know. We know, actually, if you want to know one of the things we know that works, we know that isolation works. Therefore, we know that physical contact is important. We've proven it over and over again. We know that with all coronaviruses, the main route is the it's the transmission of a virus through the air in tiny droplets in which it is carried from one person to another. And because the larger droplets fall to the ground more quickly, and because they contain most of the virus, and that's why we're giving the advice, that's why the NHS has given the advice to stay 2 meters beyond others if you possibly can. And the reason for that is that even as I'm speaking to you now, I'm sorry to be so sort of personal about it, but my iPhone in front of you is getting sprayed with very fine virus particles if I was carrying a virus. So saliva, if you had a bright light here, I could tell you, if you're on the stage and you watch an actor, you can see it happening. A bright light will show you a very fine mist coming from the mouth of anyone who's speaking. So it's nothing to do with coughing. Coughing, yes, of course, produces a huge amount of stuff. So does sneezing, but just talking is enough. So distance is important. And anyone who is carrying the virus will be potentially infectious within a 2-meter space, even if they're not coughing. Now, we know that only 10% of infections seem to happen from people who are asymptomatic. I'll say that again. Only 10% of the people getting coronavirus seem to have been infected through someone who was well. Okay, so you reduce 90% of your risk if everyone who is unwell stays at home, self-isolates. If people don't turn up to work, you reduce 90% of your risk if you stay well clear from anyone who says that they're ill or is coughing away. That is 90% of your risk gone. So that's 10% of your risk gone. There's 90% of your risk gone if you stay away from people who are obviously unwell. Only 10% of your risk would be just casually traveling on the underground with someone and having a chat with them, and they seem to be completely well, no fever, no cough. That is relatively safe. And we know that the symptoms, the average length of time to produce symptoms is about 4.5 days. Now, it's true that you can carry this virus for 2 weeks, maybe, without developing symptoms, which is why people are being told to self-isolate for that period. But if you've been self-isolating for 4 days and nothing's happened, and you're on to a 5th day and nothing's happened, the good news is that you're probably unlikely to get it now. You may, but it's becoming less and less likely with every passing day. You should still stay in self-isolation for 14 days. But as I say, the critical period is the first 4 days. So what about other questions people have asked? You know, people ask about their particular countries. And some people have said, well, what about summer? Will the summer months change this? Will heat change this? It could do. We know that seasonal flu is hugely affected by the month of the year. So in a country like the United Kingdom or France or Germany or the United States, seasonal flu falls off a cliff, usually around now in May, which is really good news and a very good reason for trying to delay the spread of this pandemic. Because with every week that we can push this pandemic spread into the future, we see a collapse in other pressures on health services from ordinary flu, coughs and colds, and associated pneumonias. What about coronavirus? This particular coronavirus, could this be, I'll come back to parallel such strains at the moment, some stronger and weaker. Yes, there probably are. But firstly, can I just come back to what we were talking about before, which is the seasonal impact on coronavirus. Could coronavirus be like flu? We don't know. Unfortunately, it seems to have spread very efficiently in places like Singapore, which have a very high temperature, 30, 31 degrees at the moment. But actually, if you plot it out internationally, it's interesting that we are seeing a band of infection, it seems, across countries which are more temperate. And that gives us the faintest clue of a possibility that this might indeed be a virus which will be hit negatively in terms of its capacity to spread as the weather gets warmer. I hope and pray so, because we need the additional time. Now, a question's been asked about parallel strains. There's some research out of China which suggests that this virus has had one significant mutation already in the last few weeks. It happened, we think, back in January, and it has affected the way in which the virus spreads. It actually became more efficient at spreading. Now, this is normal. We expect there to be evolutionary pressure on the virus. Every time the virus enters another human being, it's being attacked by another immune system, and it has to adapt. It's being forced to adapt. And many viruses become less mutant, and many strains of flu become less aggressive, less lethal as they pass through populations. And again, we hope and pray that this will happen to coronavirus. We can already see very small genetic variations within the two major strains that we've seen so far. And these also help us to plot the descendancy. You can say, this particular strain probably was caught from Austria, because a very slight change in the genetic code, we can see a very slight mutation. It's not changed anything fundamentally about our treatment, about the virulence, infectivity, but nevertheless, it's a way of kind of fingerprinting that particular source. But we can expect to see more significant changes over the next few weeks and months. Now, some have asked me about, what's going to happen to big industries like airlines, and the economic stimulus that the Chinese government, the American government, the European governments are giving. Will that be enough? And the issue is this: governments can't afford to see perfectly good companies just completely destroyed. This is quite different from the economic crisis in 2008-9, when we had a systemic problem. We had all kinds of interweaving financial risks that ricocheted around the world, and it was very difficult to put right. Not only that, there was a moral hazard in putting it right, because some would argue that the reason the banks were in the mess in 2008-9 is that they had been irresponsible in their lending. Now, we can debate about that, but the fact is the governments did not want there to be a moral hazard. That is to say, they did not want to pump money in that might, in a future world, encourage more bad risks to be taken, because people thought, the banks will always get bailed out again. But here there is no moral issue. There is no question about bad decision making by companies in the past. This is just a straightforward, what we call a wild card, a massive issue. Doctor, this is a virus, so why won't it keep mutating and reinfecting as humans? Well, it raises a more fundamental point. Every year there are new viruses which emerge somewhere in the world. They usually have jumped from animals into humans. Typically, what can happen is you have a human that's got flu. They then get infected with a similar virus in animals. Both those viruses get inside the same cell, and the cell gets confused about which particular virus to make, and out comes a hybrid. And the hybrid is one that's never been seen before by human beings. There's no immune system, and so that's the challenge. So could we see new variants of coronavirus? Of course. Every year we see a new mutant virus emerge somewhere in the world, at least one. Most of them are so dangerous that they die out. How's that? You see, if you have a new virus, which, kills 10 people in a village within the first week, it may well be that it's killing people more rapidly than it can spread. You see, the most dangerous viruses are not the ones which kill lots of people. Well, let me rephrase that. The most dangerous viruses are not the ones which, say, have 100% mortality. The most dangerous viruses are those actually which have quite a long period without any symptoms, make lots of people very infectious, and only kill a few. Because those are the viruses that spread a very long way. Yes, of course. GKBXO, of course you can ask a question. Please just tell us what the question is and I'll do my best to answer it. Is the virus encapsulated in fluid? No, let me explain what viruses are. You see, viruses aren't alive. You can't kill a virus. See, what? You can't kill a virus. You can destroy a virus. A virus is like a nanotech machine. It's just a nanotech robot. It's got a fragment of genetic code inside it, and it's surrounded by kind of legs or arms with receptors that precisely fit onto particular cells. So a virus against, let's say, cells inside the nose has a precise plug on the end of it which fits exactly like a socket, a spanner in a socket into nose receptors, okay? It's not alive. There's nothing alive about a virus. A virus is just, as I say, a nanotech machine. It contains genetic code, and when it gets inside that particular nose cell, if it's a virus inside your nose causing the common cold, say a rhinovirus, it programs that cell. It hijacks the cell and turns it from a nose cell into a virus-producing factory, which will produce typically maybe say 200 virus particles. It then dies and explodes, shedding those virus particles. And so the infection continues. And of course, when you sneeze, you then sneeze it out. Now with coronavirus, the main target is not so much the sort of mucus things in the nose. It's more the throat, and the lungs are a prime target, which is why we're getting coughs rather than sneezing as the usual major symptom early on with coronavirus. Now, can I ask questions? You and your sister are unwell and advised to stay at home for 7 days. Your younger sister has just come home for school for 2 weeks to stay indoors. Okay, so yeah, half the world. Yeah, so lots and lots of people in that situation. You need to stay at home for 14 days. You need to be isolated. You need to be sure that you're keeping 2 meter distance from anybody that comes to the door. No one should be coming into your home, and no one should be going out. If you possibly can, use your iPhone, whatever you need to do to get the food and supplies that you need in, but basically you're grounded. Okay? And the reason for that is, well, let's put it into context. Almost everyone who gets infected with this will have a nasty cough or maybe no symptoms at all, but basically they'll work their way through this fine. You're not going to need any medical help. But some people will. And as I said earlier, if you have 100 infected cases detected, that's different from the number of people who are actually carrying the virus. But if we have 100 cases detected in a typical country like Italy or the UK, then of those, you can expect, at the same time as you have 100 cases reported, you could well have around 12 in hospital, 6 in intensive care, maybe 4 of those on ventilators. 2 of them between the ages of 20 and 60, younger people, 2 of them older people. And those 2 people who are older will have maybe a 1 in 5 chance of not surviving at that point. So this is quite a really serious thing for those who get very sick. And which is why we want people to isolate. It's not necessarily for your sake, it's for the sake of some other person you might infect who may well land up in intensive care, who might well not make it because they're an older person, maybe they're younger, but you don't know they've got lots of medical records. You see, the dangerous thing about the virus is not what happens first. Most people go through the same relatively mild condition for the first week. The problem is what happens then. It's the second phase when the immune system starts to kick in. And those who have big medical records, lots of medical problems, find that a real challenge. It's the second phase. Now, not only some people get a second phase, but the second phase, you don't know if you're going to have that for quite some time. So stay at home, stay well, self-isolate. Okay, is it safe for me to go back into work, even though I have a minor cough? Well, it's difficult to say. If you've got a fever and a cough, you need to stay home. Actually, the government's saying in the UK, if you've got a cough, you stay home. Why? Why would you go to work? If you have to work, okay, but basically, we're hoping and praying that most people can manage to cope with 4 or 5 days at least at home. If that minor cough's gone and you haven't had any fever tomorrow and the day after and the day after, okay, you might come to the conclusion, talking to 111 or whoever your medical advisors are, that maybe it was just a minor cough. But if by tomorrow you're starting to get a fever, if that cough is going on, you are going to stay home, my friend, for 14 days until you're better. And what is more, the rest of your group in your house need to do the same because they're potentially infected. Even though I still feel better, do I have to stay indoors? Absolutely. 10% of all the infections in this country are happening from people who feel absolutely well, like you right now. Think, I'm splendid, I'm fine. Well, you might not be. If you've had a cough recently, say a fever 2 or 3 days ago, you're absolutely not right to go to work yet. Okay, 14 days from the beginning of symptoms is what the government is saying in most countries, and that's absolutely right. Am I right to? You say we can't destroy viruses. Well, we can destroy viruses, but you don't kill them. Let me. All right. Viruses aren't alive. You see, I shouldn't be touching my glasses, but I am actually in a sterile environment here. I have self-isolated now for several days and will continue to do so probably for the next 3 months. Okay, so you can't kill a virus because a virus isn't alive. It doesn't eat. It doesn't sleep. A virus can't divide. It doesn't consume energy. It doesn't produce toxic waste. It is just a bag of protein with a tiny piece of genetic code inside it, a bit like a virus in your computer, okay? It's just an instruction to hijack one of your cells. And once a virus touches that cell, the little bag of protein with its receptor on the outside that's exactly the right shape to fit, say, one of your throat cells, once it's locked onto a throat cell, that virus literally dissolves, it injects its genetic package, hijacks that cell inside your body, and turns it into a virus factory. And from that moment on, that cell is doomed. It will produce virus particles until it can't do any more. It will explode, releasing around 200 virus particles. Some of those could well be released into the environment, but others will go on to infect other cells in your body. So you can destroy viruses. You can deactivate them, these nanotech robots, these genetic machines. You can destroy them actually relatively easily. In fact, on your skin, the good news is that a virus on your skin, there are lots of scientific studies have shown that skin itself is good at getting rid of viruses. In fact, if you were to get a small amount of virus onto someone's hand, and studies have been shown that for infectious virus, after 5 minutes, 10 minutes, 15 minutes, and half an hour, the level starts to fall quite radically. Same on the face. That's the good news. Bad news is that on a computer or a coffee table or something like that, the virus can survive for 24 hours. So that's why we need to take care. What sort of, am I right to assume that this is not something likely to blow over soon, within a few months? Absolutely right. You can go through, you can try and go through sort of, a slight slowing down of this, and the numbers the numbers at the moment are doubling in most countries like Italy, Spain, Portugal, the United Kingdom, the United States, Canada. In most countries, the numbers of infected people are growing by a factor of 2, roughly every 4 to 5 days. So if you want to work out what's going to happen next without major action, take out your calculator, type in the number of cases from your country, and then type ×2 and then equals. And that gives you 4 or 5 days. Then ×2 equals, that gives you the total in 9 days. ×2 and equals, that gives you the total in about 12 to 14 days. ×2 and equal, and again, and so on. Someone asked about the UK. Well, okay, we've got 71 deaths. And the government itself is saying around 60,000 infected, maybe. It'll be between 50 and 70,000. It could be 70,000. Why is that? Well, we just know that from tracking other surveys. We should not be deceived by the total number of infected cases we've detected, which is only 2,600 in the UK. So think about that. The government is saying 60,000 people have it, but we only know who 2,600 of them are. That's despite having tested 60,000 other people. So the real issue is, as I said at the beginning of this, to get to grips with the severity and understand what's actually happening in your country. Take the death rate, multiply it by around 1,000 to give you the number of people who are probably carrying the virus at the moment, and then multiply that by a factor of 2 for every 4 to 5 days for the next month or two. And that would mean, say, 10 doublings in 40 days. That's in a month and a half. 10 doublings, which is 1,000 times what you got today. So on this particular calculation, that's why the UK is going steadily into lockdown. Okay, so I'm just having look. Face masks. Okay, face masks. Look, we're all paranoid in the wrong direction. If you're on a tube and you're wearing a face mask, I can tell you that unless it's got a proper filter on it, if you actually were to observe smoke in a room, most of the smoke will come around the sides of the face mask and into your lungs. So if you've got an aerosol of virus, you're going to breathe it in. A face mask would prevent you, in theory, from someone going right at your face. Okay, it would shield your face, but I assure you, you still, unless you take a deep breath for 5 minutes, you're still going to breathe that stuff in. So face mask is not good for protecting the person who's wearing it. Even worse is if you keep touching it and moving it around, because then you've got contamination on the front that's spreading its way all the way around. And even how you take the mask off and get rid of it. Now, the face mask, if it has any real purpose, I'm talking about small, relatively flimsy face masks rather than the things that doctors and nurses hope that they can have access to all the time. But if we're talking about protecting yourself, then actually it's the person who's coughing that wearing a face mask that really matters. Suppose someone in your family has this and you're nursing them. Well, you're going to be trying very, very hard for the sake of the person who's sick to stay well yourself. Really important. So they'll be in a well-ventilated room and lots of windows open. And you'll be spending as little time in that room as possible, standing in the doorway only. And hopefully, if they are seeing you come in, they're putting on a mask, if they've got one. Why is that? Because if they were to, sorry, they were going like that, the face mask will capture an enormous amount of cloud of stuff. That's really important if you have a face mask, but not for just wandering around on the streets. Actually, the risk of getting infected as you walk around in the open air is relatively small. Okay, does hand washing work? It certainly does. There are lots of studies showing this. I said already that the skin itself has a natural protection to it, which is just as well. Nature has designed us quite well, you know. And if you look at the level of infectious virus on your skin, if someone sneezed from someone a meter away, with a bit of that virus was to land on your hands, or if your hands become contaminated from a work surface, if you did nothing with your hands, and we could test the amount of virus on your hands after 5 minutes, 10 minutes, 15 minutes, and half an hour, and an hour, and whatever. And we can see a dramatic fall in the level of viable virus, and even more so if people are using their hands. So they're using the computer, rubbing their hands, putting them in their pockets, whatever they're doing. All of that makes it less likely the virus survives. Now, that's really good news. So, you know, you might feel paranoid that you touch something on, someone's computer or something, and you'll be contaminated for the whole day. Well, actually, even if you did nothing, the infectivity will fall. So keep your hands away from your face. That's the important thing. Washing your hands is really, really good because it produces an instant dramatic fall in the viral count on your just washing them for what we're saying, 20 seconds with a soap. Why? Because soap, like the fats on your skin, it dissolves the outer layer of the viruses. The viruses are fatty, so the fats in your skin don't do the virus too much good, and soap doesn't do the viruses too much good either. Wash them underwater, and almost all of that contamination is gone. But even if there was some contamination, keep your hands off your face, because your body has a method of destroying those virus particles as those minutes go by. Same as the virus on your face. You might think, oh my goodness, I've touched myself here. Perhaps I'm now contaminated for the rest of the day unless I go and have a shower. No, I promise you, by the time you have a shower tonight, the virus level on that tiny spot has probably fallen more or less to zero. The challenge is touching, is pushing things around and getting things up your mouth and things like that. Okay. I said yes, of course. Very good point. Thank you for that. The immune system. Your immune system is what prevents you from getting sick, but unfortunately, it's your immune system that also does you in some circumstances with coronavirus. So see, people who have experienced a lot of challenges to their immune system. Maybe they have diabetes, maybe they've got chronic asthma, maybe chronic obstructive airways disease, maybe they've had lots of pneumonias in the past. Basically, they've got medical records, that thing. If someone's like that, they've got an immune system that's been hyper challenged lots of times. And those kind of patients, when they experience this virus, they tend to go through the first phase relatively okay. They sorted it out at home, but then they get a second phase when they're actually beginning to feel a bit better, maybe sometimes. They have a second wave when their immune system is really mega kicking in. So for that purpose, I don't have any specifics on multiple sclerosis. Thank you for that question, Dwayne. But I can tell you that in general, the thickness of the medical history is linked to a poor outcome. So certainly, if I have multiple sclerosis, I'd be wanted to be careful, and for lots of reasons. If it depends on the degree of disability. But if someone has multiple sclerosis and they have a lot of mobility issues, then it may be affecting their ability to cough. It might be having other impacts on their body, which could put them at added risk. So I would say, stay well, take care of your health, look at your total health care pattern. And if you have a poor health history, you need to be particularly careful about self-isolating early. I've got a blocked nose. Do I have corona? Well, the good news is that, the kind of sniffles that you get with a common cold are not so common. They can happen with coronavirus, but this particular coronavirus is producing more of a dry cough type of problem. You'll see a list of symptoms on all kinds of sites. I'm not going to go into them all, but the normal cough and cold is not the normal, which starts with sniffles and sneezing. Yes, some people sneeze, but this is not a classic sneeze. Oh, I'm going to get corona. Okay. That's more like a rhinovirus, a common cold. Okay. Do I need to self-isolate from family? Well, you know what the advice is, which is that you should be self-isolating if you think you've come into contact with someone who has a fever and a cough, or even a persistent cough, or even a fever, I would say at this point in isolation. Why? Because you'll know in 3 or 4 days if it is or it isn't. Because if they've got a fever and then they develop a cough, well, okay, it's much more likely, isn't it? If it's just a very transient temperature for a few hours, okay, maybe it's something else. But we just need to use common sense in this. And I would say, why not self-isolate? I mean, the British government has said that everyone, not just those who think they might be unwell, everyone in my country only has officially 2,600 cases, okay? My country has only had 71 deaths. But my nation's government is already saying, and I support them in this, that everyone should stay home if they possibly can, unless you absolutely have to go to work, to stay home. If you can work at home, stay home. Why would you go to work? Someone said to me the other day, oh, perhaps I need to do this. I said, why? Stay home. Do the work at home. Thank you. Someone's saying it's now 120 deaths. I stand corrected. It was. These things are increasing by the minute. But the issue is this: stay home. If you are if your normal pattern of work life would be to go out to the pub, stay home. If you would normally walk to the dog and talk to all kinds of people in the park, walk the dog, but stay 2 meters away and go back home. If your normal pattern is to go shopping every other day, don't do a big shop, stay home and live off your supplies. Okay, so everyone will be in their room by themselves. Well, not quite. Well, it depends whether you live on your own at home. If you're staying home with others, you'll be with them. You have a continuous cough, someone says. If you have a continuous cough, I don't know what country you're in, but if you're in my country, you should stay home. And it may well be, let's hope and pray that you have a very mild days of this, in which case you maybe have very few symptoms. Other than that, you might have a very slight temperature, but you'll need to self-isolate for 14 days. But you should be doing that anyway, is what I'm saying. There's nothing particularly dramatic about whether you have the cough or whether you don't. Yes, it might be in terms of your fear you've got coronavirus, but most people will just have mild symptoms. The issue is protecting the spread of the rest of the wider community, to enable health services to plan, to train, to get hold of the supplies they need, to convert hospitals, and provide the very, very care that you hope you will get if you need to go into hospital. Do I need to self-isolate from family? If you're symptomatic, you should. Why? Because out of care for your family, and you need them to look after you. So you don't want to be spreading it through the family. So you need to be in a room on your own. No, I didn't touch my head. It's quite easy to do it. You need to be in a room on your own, and well-ventilated room, and stay away. Take care of them. Why? Most of them will do fine if they get coronavirus. Many of them won't have any symptoms at all, or hardly any. But you know what? 1 or 2 of them might get something that they can't shake off. and they might need hospital care. And it's very important for the whole community that we relieve the strain on the NHS and other health services as much as we possibly can. Why? Not for your sake, but for the sake of someone else who's really desperately ill, who will really, really, really will need a ventilator and all the best care in the world. And we don't want them to be blocked because of someone who just decided not to self-isolate in their bedroom. Let's be sensible about this. What's your view on the stock market meltdown? So many people getting out. Well, of course they are. I think that the common sense will prevail. What governments around the world are doing is what they did with the 2007, 2008 crisis. And they are basically saying, watch my lips. We will do whatever it takes to support the markets and businesses. Say that again. Watch my lips. We will do whatever it takes. Don't take any notice of what we've heard so far in terms of announcements. We, as a government, will do whatever it takes. The French have been very bold. They're saying they don't want a single business to fail. I don't know how they manage that. The British government have just thrown the equivalent of 12 to 13, 14, 15% of GDP at this thing, and they've only just started. So once the markets understand that governments really mean this, that the governments are prepared to mortgage the future in terms of government debt for half a generation in order to solve this challenge now economically, then you will see some stability restored to the markets. Markets don't like uncertainty. They just need to know that the thing is being fixed. And this hurricane will pass. Coronavirus will not be here in this kind of crisis forever. It will pass in a shorter time than many fear, but a much longer time at the moment than many others expect. Quite right. Someone says, if you're still unsure and panicking, go to the NHS website. You know, the NHS website is absolutely full of excellent things. Someone says, is Tesco going to close? Well, it's certainly not going to go bankrupt. Why on earth would it close? It might well ration. It's already started rationing. And if people don't behave properly, then the government will impose things upon us. So a government starts by saying, please don't go to the pub. If people go pouring into the pubs and gathering around cinemas, and the cinemas are all closed anyway, but if people don't behave, they will be legislated against. That's why in Paris, you've got members of the army and police force patrolling apartments, entrances, arresting anyone who goes out. Why? Because they decided they couldn't trust people to just walk their dogs. They thought they would associate, or they were associating. So the government has put out a decree that people have to stay in their flats, their apartments. So we need to be responsive, responsible, caring of others in the whole community, and do what we can to prevent ourselves from getting infected. Not because the risk to any individual is very high. In fact, it's very low. But the risk to our community is absolutely huge. Herd immunity. What is herd immunity? Okay. This is a controversial term, but it's a statistical fact that a virus can only spread where there's a large enough group of people who haven't been infected before. Every time it hits up against someone who's already had it, it's blocked. So the theory is, and of course it's a reality, that when you get more than a certain percentage of a population, or we could debate about whether it's 40% or 60% or whatever, when a certain percentage of the population already has antibodies to the virus has a very hard time finding another person to infect, and the whole thing tends to crunch down and stop. Now, you can still get little pockets of infection all over the place, and then it can flare up again. But herd immunity is when you get a lot of experience of the virus within the community. And if not of that precise virus, it might be a slight variant of it from some previous year. The difficulty with coronavirus is that it's very new, this particular virus, to us as a human population. Whereas other variants of flu, we've seen in the past, there's some herd immunity already. It doesn't spread in quite the same way. So herd immunity is very important. How do you get there? That's the challenge. Now, my own view is that once you get to this point, you've got virtually every country in the world who's got virus cases, whether they know it or not. So we're going to have to live with this. This will be part of the medical textbooks that medical students will need to learn about for the next 100 years, probably, unless we can find a vaccine and vaccinate the entire world against it. But you know what? A few years' time, there may be another variant, which we don't have immunity to, and the thing starts again. So that raises a second issue, which is the urgent need for antivirals, as effective as penicillin was in 1942, which we still don't have. But herd immunity at the moment is a fact of life. That's how viral pandemics usually cease. They burn their way out as they gradually work their way through populations. I haven't stocked up any food because I can't even go out. I assume that's because you're unwell. Well, I just hope and pray that you need to be alerting friends around you to do that. If you or obviously shop online. Why are governments always changing their mind on tactics? Are they unsure about the virus? They sure are unsure about the virus. Yes. Why are they unsure about the virus? Well, one reason is that they can't predict human behavior. So, for example, the government in the UK has asked people to stay at home. They have said, the whole population, you're grounded. Unless you're a doctor or a nurse or a policeman or a fireman, or you're a fisherman, in which case we need your fish. You're working in the ports, we need the food. You're stocking supermarkets, or you're dealing with the post office, or electricity, or phone system, or water supply. You need to stay home. That's what they're sort of saying. And so long as what they can't predict is what the response is to that. How seriously will people take this? Friends of mine are saying, "Oh, carrying on social life as usual." We've taken the opposite view. We are basically putting ourselves into self-quarantine, more or less now. So if you can't predict the behavior of the population, how on earth can you predict how fast this virus is going to spread? And then, of course, we also have other challenges. We don't know how quickly we can ramp up medical care. We've never done this before on this scale. No country has ever done this before at this scale. We don't know how quickly we can ramp up the supply of vital things like the anti-infection visors, the spacesuits which we need to look after the sickest people. These are things which every country is struggling with right now. So yes, governments are right, absolutely right, to have a flexible strategy. I have often said this to companies. The world changes faster than you can hold a board meeting sometimes. And that's certainly true for governments today. So please don't fix your strategy. Please don't say, this is our plan for the next 6 months. You need to have plan A, plan B, plan C, plan D. And as the situation changes, you call out the plan that's appropriate for that. And that is wise leadership. What are some good food items to stock up on? I have no idea what you like, but basically things that last a long time. Okay, any final questions? I'm going to wrap this up because I've been going now flat out for nearly an hour, 46 minutes. We've had loads of questions coming in. This has been my first broadcast on this